Good morning. November 19, 2024. I'm Dr. Duke Majan here with my team at Duke Spine Institute. Our patient comes from Florida, the Villages, retirement community, largest in the world. It has, I think, over 100,000 homes and growing. So she's here because she's had back pain for a long time. And she's had a laminectomy. You can't see the scar, but it's there. It went all the way down to here. You can see a little bit there. All right, Dr. B, can I start by injecting? All right. So we're going to do a little injection of some numbing medicine and try to numb things up for her. This surgery you're about to watch is called the Duke Laser Disc Repair. It's the most advanced spine surgery in the world for treating pain, chronic back pain, chronic neck pain, or thoracic pain. I may need more. Let's get some more. And it's the most advanced surgery in the world because it's the most successful at getting rid of back pain, also the least invasive, and the fastest recovery, and no need for post-operative narcotic painkillers like other types of surgery. All right, you can see the needle there. The entire surgery will be done in an hour for this part. And the patient is not intubated. She's just sleeping with propofol sedation. So there's no worry about general anesthesia, no tube, no hospital stay. It's outpatient. We've been doing this Duke Laser Disc Repair now for 19 years. We've done over 2,200 patients and counting. Sean? All right, we're right at the facet joint. And that is our first disc we're going to be fixing. You can actually see the herniation at L3-4, which is the next disc we're going to be going after. Right there. It's in the back. It's kind of calcifying. It's getting a lot of calcium in it, so you can see it on the x-ray. Normally you don't see a disc herniation on the x-ray unless there's some calcium. All right. We're going to get into this disc. Sean? And let's get an AP. We're using x-ray guidance. All spine surgeons use x-ray guidance. Doesn't matter what kind of surgery you do, laminectomy, discectomy, we all use the x-ray machine. This x-ray we're using is the top of the line, best in the world. It is a Siemens. It's called the Siemens. Jordan? Huh? Flow. Everything okay? Okay. All right, you can see on the front view of the x-ray that the needle is in perfect position at L4-5 on the left. Let's get another shot. Yep, we're exactly where we need to be. We're going to enter this disc. And that's our first disc we're going to be working on. I'm going to make an incision. I'm trying to get through the L3-4 disc through the same incision. Hopefully we can do that. The nice thing about her spine in particular is that it is posterior. It's towards us up here, so I don't have to reach too far anterior to get to it. Some people's spines are very far anterior, something that's never been described by anybody but me. And the only reason I describe it is because I'm doing endoscopic surgery, which all my instruments, the deeper the spine, the harder it is to do the surgery. Okay, we're aiming for the next disc, which is 3-4. Everybody agree with that plan? Yes? Sean? Uh-huh. Let's get an AP view. AP means front, back, anterior, posterior. If there's any questions, feel free to type them up. I'll answer them during the surgery. She does have some osteopenia. Oh, it's perfect. And we're going to be doing both sides at L4-5 and just the left at L3-4. After we're done here, we're actually going to be performing a sacroiliac joint Duke plasma rhizotomy to get rid of SI joint pain. And we're going to be performing a piriformis muscle release. So she has not just disc pain and pinched nerves on both sides, but she also has horrible pain in her SI joint. This is the SI joint right here. It literally runs from here to here, and she has horrible pain in her piriformis muscle. So she has a torn piriformis muscle and an inflamed SI joint. Shot. Wow. We had a nice prayer before the surgery, And it seems that God is listening to our prayers because God is making things go very nicely for her so far. Any questions?
No current questions, so we do have a comment coming from Hassan on YouTube.
Hello, Hassan.
Hassan, correct.
Welcome to our live stream, Hassan.
Saying my favorite live stream every Tuesday.
Thank you, Hassan. We appreciate that at Duke Spine. And I believe I remember you from last time.
Yes, correct. He was here last week.
Yeah. So this case is our first case. You're going to watch the Duke laser disc repair. And then we're going to perform, let's put some num-num. And then we're going to perform the SI joint next. So we will end the live stream when we're done fixing the 2 discs with one of them being on both sides. Then we're going to come back and start another live stream where we treat her left SI joint pain. She has arthritis in the joint. It's horribly painful and tender. And then we're going to stop that stream and come back and do the piriformis release. All right. Thanks for joining us. And Henry,
yes, sir.
I think it's worth showing the audience our video on the 30 causes of chronic back pain so that people can understand there's not one cause of back pain. There are 30 things that can cause back pain. And the most common, by the way, is the disc. An injury to a disc is the most common cause of back pain. The most common disc to be injured is the L4-5, and that's the one, the most common disc to be injured and cause pain is L4-5, so to be symptomatic. Remember, there are disc injuries that are not painful, and we don't treat non-painful disc injuries. So if somebody has a degenerated disc but it's not causing any symptoms at all, we don't treat it. There's no reason to treat it. We can't make that better. Asymptomatic disc injuries are left alone. It's only when the disc is causing symptoms that we want to offer treatment. Remember, treatment has risk, and people should not be exposed to surgical risk or treatment risk unless there will be a benefit from that risk. The benefit, of course, is pain relief. All right, I'm just passing the facet joints at 4-5. Everybody agree? Let's get an AP view and see where we are. But we're almost in the disc at 4-5 on the right. It would be nice if she was a little awake and we can see if we can recreate her pain with a discogram. That looks perfect.
Okay, we're going to ask you a question, okay? Okay, she's awake. We're going to ask
Hey, you're doing great. This is Dr. Duke Machen. Everything is going well. I just wanted to ask you something, okay? Can you answer for me? Are you having any pain right now? Huh? Boy, a lot of scar tissue in that L4-5. All right, are you comfortable? How long have you had lower back pain? How many years? When did it first start?
1989.
Wow, 1989. So in the year of 1989. How many? 35?
35 years, yeah.
Thanks for doing the math. 35 years. Well, my friend, you are going to no longer have that pain after today. Isn't that incredible? 35 years. All right. Are you having any pain right now? No? All right. How bad is that on a scale of 1 to 10? How high does it go?
What's the number?
9. Is that where you get your back pain? Yes? All right. We got 9 out of 10, and it's concordant, meaning that's where she gets her back pain. Is it better now? That pain will be gone when you wake up from your surgery. It'll be gone for the rest of your life. Isn't that good news? Yes, it is. How bad is that on a scale of 1 to 10? How high does that go? 11? Oh, 9.5 was the highest? All right, well, we round that up to 10. So 9.5 becomes 10. Is that where you get your pain? All right. Great news. We found the 2 painful discs, the ones that I expected based on the Duke spine exam. And we're going to get rid of that pain for you right now. All right, Henry, let's show the audience the 30 causes of chronic back pain so they can understand It's not one thing that causes pain, it's usually about 4 things that are causing pain on the average person.
Of course.
I'm Dr. R. Dugmajian with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. Welcome back. You can see from the video we just played that chronic back pain, which is really, that's back pain, folks, all right? There's acute back pain, which is going out and suddenly having back pain you've never had before after a car accident or something. That's called acute ACUTE. It's back pain that lasts for 2 or 3 days. But chronic back pain, which is the back pain that most of us are talking about, it comes mostly from disc injuries. That's what Duke Spine Institute discovered. I discovered that. Over the years, we sort of got a feeling about that based on people coming in and fixing their disc problems and getting rid of their pain. But then we did a formal study. Arias Duke-Majan actually was the lead author. He analyzed 5,000 of our patient charts, 5,000 charts, and found that the most common cause, as a major cause of back pain, was the disc. And we discovered that the amount was 87%. We just say 85%. I'm actually grabbing the needle on the other side. It's down there. There it is. You guys see the needle from the other side?
Yes, we do.
I was grabbing it and I was pulling and I couldn't take it out, and I realized that must be the needle from the other side. So remember, we're doing bilateral 4-5. We have a needle down there. We just got to be careful not to melt it, because if you melt it with the laser, you won't be able to put the guide wire in. Is this a new bag?
Yeah.
It's a new idea, huh?
Yeah.
Working out good?
I mean,
Cost-wise? Really? Oh, that's nice. I like it. This is really good, Luis. Good job. Hey, fist me. Sorry. So, I could have said high five, but it was a fist. Sorry, folks. Don't get excited. We don't discriminate here. Anyway. So the most common cause of chronic back pain from the video, you can see 85%, just to make the numbers easy, 85% is the disc, injured discs. And it's not one disc that's the cause. It's usually 2.5. 2.5 discs are the average. So if I take all the patients in those 5,000 that had back pain, and I looked at, all right, well, who has the major cause of their back pain is a disc injury, like a herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, then those patients that have the disc as the main cause, the primary cause, if you ask how many discs are causing their pain, 1, 2, 3, 4, how many? The answer is 2.4, 2.5 basically, discs per patient. That's the answer. And we confirmed this data by doing the laser surgery on more than half of those patients. We got 99% pain relief of their primary pain, 99%. So the only way you're going to get 99% pain relief operating on the disc is when the disc is the source of pain. So it was a confirmation test by doing the treatment and having great results. All right, you can see the needle down there. You guys see it really good right there?
Yes, we do.
And if I hit that with a laser, it will melt it, literally melt steel. That's how powerful this laser is. So I got to be careful not to damage the needle. All right, we're going to slowly back out, and we're cleaning the tear. This is called the annular debridement. It is how you fix an injured disc. You use a laser, you remove the scar tissue and calcium. You see the calcium is the golden stuff. Scar tissue is the white stuff. Most of this is scar tissue here. Some of it is calcium. But the laser is the only way to do this, and that's why we call it the laser disc repair, Duke laser disc repair. I'm the one who pioneered it. It was my discovery, my invention, and we've been doing it now for 19 years almost. And our success rate of getting rid of the disc pain is 99.6. That's the average, 99.6 with this procedure. And there's no fusion done. There's no metal. There's no screws, no hospital, no bleeding, no pain meds afterwards. Patients take a Tylenol, maybe that's it, and they go home with a Band-Aid. That's it. All these other doctors are doing fusions and artificial discs, dangerous surgeries that don't work, and the patients still have pain afterwards. So If you want your back fixed, you come to Duke Spine Institute. There's no other safe way to do it. We're the only ones with this technology. And I know we have some questions, so we'll get to the questions and then we'll come back to our video, and I'm going to talk a little bit more about other causes of back pain.
Of course, this question coming from Raj on YouTube,
Hello, Raj. Welcome.
saying, "Hi, doctor. What do you think of neuromodulation procedure where they implant a device inside you and attaching and inserting a rod, which they say changing how nerves work, reducing pain? Have you done this?"
Yes, Raj, we do the neuromodulation procedure. So neuromodulation procedures have been around for about 25, 30 years now for this type of problem, pain. The spinal cord stimulator is what it's called. That device, we at the University of Florida in Gainesville, when I was training, this is about 25 years ago, we were one of the first institutions in the world to put them in. And we put them in patients that had very specific diagnosis, okay? That diagnosis was chronic radiculopathy that could not be fixed with surgery, like laminectomy, okay? So it was basically nerve damage that was not fixable with this type of surgery you're watching now. And it worked fairly well. We got 50% results, basically 50% improvement overall for all the patients, okay? And that's the same they have today. And this device was put in for chronic radiculopathy and put in for peripheral neuropathy, end-stage peripheral neuropathy. That's people with neuropathy that cannot ever be fixed. It's impossible to fix it. Grab her. And so if you have chronic neuropathy or radiculopathy that's inoperable, that's when you put those devices in. The problem, my friend, is that the companies that make those devices are making so much profits on putting the devices in patients that they're promoting these devices now for everything, for back pain, for neck pain, for any kind of symptom. Rather than going and fixing the problem, they're getting the doctors to put the device in. And what they've done, these companies have managed to get very good payments for the surgeons and the pain management doctors, and they're getting tens of thousands of US dollar profit per procedure. So they're promoting that device even though it doesn't work. It's a horrible device. I don't recommend them. We have been putting them in. I've told you I started putting them in 25 years ago. Spinal cord stimulators and morphine pumps, intrathecal pumps, and they just don't work well. But they're being promoted by the pain doctors because they're making so much money doing those procedures. Now, those pain doctors don't know how to do what we're doing. They don't know how to fix people's backs properly with the laser. So all they're being trained to do right now at their training center is put those stimulators, those neuromodulators in patients. And they're being rewarded with huge profits, money, even though these devices are dangerous and they don't work and they don't last. We found that when these devices are put in and they actually work, they stop working within a few months because the lead, the electric lead that's put on the top of the spinal cord moves. It shifts position on its own, not by us doing anything, but just by the patients usually getting up and walking around. The lead will migrate. They call it lead migration. And then the patients don't have the relief they have. Also, scar tissue develops between the lead and the spinal cord in the thoracic spine, and that scar tissue blocks the device from being effective. It basically reduces the signal that comes out of the electrode, the electrical signal that comes out of the electrode onto the spinal cord. It reduces the movement of electricity from scar tissue around the electrode that's implanted in the thoracic spine. So the device stops working. That's why we don't recommend it. It's not a good option for people in pain, but there is no other option that works besides this surgery, and we're the only ones that know how to do this surgery. So you have how many doctors out there treating pain? You have 100,000 in the United States, doctors that are treating pain. These are pain management doctors and spine surgeons. And these doctors don't have any other treatment that works. They have no treatment that works. They don't know how to do our treatments. And so what they do is they're being promoted by these companies to put these devices in patients that don't work. But they tote them as better than taking pills, right? It's better to have the device than to get addicted to drugs. So that's how they're managing to get more sales and promote them. The profit margins are so high. It's such a waste. I honestly need Elon Musk and Vivek Ramaswamy to come talk to me so we can save our government, American government, billions of dollars in wasted money on these pain treatments that don't work. So yes, we're very familiar with neuromodulation. We do them on patients with diabetic peripheral neuropathy that's horrible and cannot be fixed, but we don't do it on people like this that we can fix. The problem is everybody else is putting those neuromodulators in because they don't know how to fix pain like Duke Spine does, and they are so profitable. They make so much profit. As a matter of fact, these pain companies, these pain management practices in America are so profitable that Wall Street investors are now buying up pain management practices, and they're bundling them together into big conglomerates, and they're promoting those neurostimulators being put in. In the old days, back in the 80s and 90s, you may see one neurostimulator a day being put in at a center. Now you can see 10 to 15 are being put in every day. And the profit on those is $10,000 easy, $10,000 to $20,000 per stimulator. So it's all being driven by greed, and it doesn't help the patients. In my opinion, it's not helping them. And we're going to be exposing this, by the way, very soon in one of my movies. The first movie is coming out in January. I'm actually going to be announcing it soon to my staff. We're going to have a showing in the movie theater, and we're going to have all of my team there to watch our first movie. It's called Spine Scam. Apparently Netflix is already aware of it, and they're very interested. What is that sucking noise? All right, I think we're pretty much done here. But we're hoping that it is going to be streamed on Netflix or one of the other streaming services. We just don't know which one yet is going to want to stream it. So the jury is out on that. The movie is almost finished. We're just doing some sound editing, some music scores. And but I've already seen it. I've already made my changes, my edits, and I like the movie a lot. It's very entertaining. It's not a documentary. We thought a documentary would be too boring. It's a what's called a docudrama, where it seems to be a very popular way of getting the message out with a movie, a drama movie that addresses this issue. Now, I will tell you this. They just released a study this week. I posted it on our Facebook channel at Duke Spine Facebook. And it shows that there are exactly what I've told you. There are millions and millions of dollars being paid to surgeons in the United States to put in these devices by the companies that sell them. These money is being paid to the surgeons as consulting fees, as research and development fees, but they're sham fees. Because, and the movie Spine Scam addresses this. My movie addresses this. So this just came out in our media in America. They expose these doctors that are putting these devices in patients. These are screws, rods, cages. But the next one will be about pain management doctors making huge profits, recommending these stimulators, these neuromodulator stimulators, to be implanted in patients. Horribly risky surgery, very dangerous, and they don't work. And it's all driven by greed and profit. That's going to be the subject of our third movie in the series. I do not recommend neuromodulators. Get your problem fixed the right way. Look how easy this is. A Band-Aid incision, 20 minutes per disc, and this is pain-free the rest of your life. You don't need stimulators and modulators. You just need the right treatment at the right place. All right, any other questions?
Yes, we have a lot of questions. This next one coming from Raj, once more on YouTube.
I put pressure when I'm done. You guys can see the incision is about a centimeter, 10 millimeters.
Yes, we can.
And I put pressure on the muscle because there's sometimes a little bit of blood oozing into the muscle. If it gets in the muscle, then the patient will have some pain in their muscles, after surgery that can last. I've seen it last up to 3 months. Sometimes it just lasts a week or two. But the point is, if you put some pressure, you see the blood I'm talking about? It's oozing. It's going to get inside the muscle, and it causes inflammation in the muscle, which goes away on its own, but it's uncomfortable for the patient. So by putting some pressure, you keep the blood from staying in the muscle, and the reason it causes pain in the muscle is the blood is broken down into what's called hemosiderin. Hemosiderin. And remember, blood contains red blood cells. Red blood cells contain a heme group, which binds to iron, which then binds to oxygen and transports oxygen. And that's how we get oxygen throughout our bodies, right? But, Sean, unfortunately, when the blood is in the tissues, it gets broken down, and it turns into hemosiderin, which then causes inflammation, basically.
Tetravalent bonding.
Yeah, tetravalent bonding. Actually, one of the best classes I ever took in UC San Diego in biochemistry was metalloproteases, a metalloprotein class, taught by Paul Saltman, who is a biochemist and famous nutritionist, as a matter of fact. He was my mentor. Can you put pressure here? Metalloproteins, very important. I learned all about metalloproteins and how important they are in biological reactions. But obviously, well, zinc and iron. I mean, the heme group is a metalloprotein, right? So, okay. Shot. All right, let's get in here and get this one done. Shot. Let me see. Good. I know we have more questions, so I'll be happy to take those questions now.
Not a problem. Coming from Raj once more on YouTube, asking, do nerves grow back even if they are cut to relieve back pain? I don't think this is true what I read. Can nerves regenerate and reattach themselves? I know nerves that are burnt, they recover.
Yeah, Raj, great question. So the answer is very interesting, and this is the basis of my treatment that I developed and pioneered, called the Duke plasma rhizotomy. You're all going to see the Duke plasma rhizotomy next, but I'll show you right now for a moment. Okay? Here's the SI joint. SI joint. And the nerves to the SI joint are little pain nerves. They come from the middle and go over to the SI joint. There's 5 of them. All right, 5 nerves. 1, 2, 3, 4, 5. Nerves have a covering on the outside of the nerve. It's called the epineurium. And they have a perineurium. And then they have an endoneurium. All right. If you only cut the nerve fibers and destroy the endoneurium, which is the connective tissue around the little nerve fibers, the axons, the nerve will grow back. But if you cut the epineurium, which is the casing, like a sausage casing, if you actually cut it, then the nerve cannot grow back. Okay? These are peripheral nerves we're talking about, peripheral nerves. Central nerves in the brain never grow back. That's why if you have a stroke or spinal cord injury, they never grow back. These are peripheral nerves outside the spinal cord and brain. And these nerves, peripheral nerves, if you cut the epineurium, the nerve will never grow back. That's what the Duke plasma rhizotomy is. The procedure I developed is a cutting of the epineurium and perineurium so the nerve can never grow back. But if you do an RFA, radiofrequency ablation, you're not cutting the epineurium, you're not cutting the perineurium, you're just destroying some of the endoneurium and the nerve will grow back. That's why the RFA doesn't work. That's why we stopped doing RFAs at Duke Spine this year, because they don't work. We have a much better treatment that works. Great question.
This next question is coming from Jeremiah on YouTube. And this is seeking advice as well with their question, saying, my C6, C7 is fused in my neck following a botched surgery. I first had an artificial disc inserted that was far too large, 16 millimeters in height, compared to the adjacent 6 millimeters in height.
Wow.
When they took over the size disc as they could, only bring the disc height down from 18 millimeters to 9 millimeters. But I'm still in solid pain every day. Do you think it's worth the risk to go for another disc?
Okay, first of all, Jeremiah,
Correct.
you need to come to Duke Spine. We will eliminate your pain. We will get rid of it. They will not. They will not. That 6 millimeter disc you're talking about is probably not the cause of your pain. You need to come and do our MRI review. Come to Duke Spine. Let us fix your pain. They are going to botch your neck surgery. And the botching could be a lot worse. You could have an esophageal injury, carotid injury. Remember, it's much harder to go in the second time. So if they're complete idiots the first time, they're going to be even bigger idiots the second time. Do not go to them. Come to Duke Spine. Do yourself a favor. Whatever it costs you, just come here and get it done right. Do an MRI review. It's free. We don't charge. And I'll tell you what's wrong. Okay? All right. I'm going to get started. You guys see the laser fiber?
Yes, we do.
That is, oh my God, 7 millimeter? No. Sorry, 1 millimeter. I'm having a brain fart. That's a 1 millimeter fiber, 1 millimeter. That's how small that is. And you saw the red stuff. That's the inflammation. That's where her pain is coming from in the disc. The inflammation or redness stimulates pain fibers that are found in the back of the disc, causing the patient to experience highly localized pain. And that pain is transmitted by the nerve fibers. They're called the sinovertebral nerve. And that sinovertebral nerve fibers goes up to your brain, and it basically creates pain in your brain. Now remember, we saw this as a calcified disc. Here's why. Look at that. Look at all that gold color. That's all calcium. So what we saw in the x-ray was right. This herniation is calcifying from so much inflammation, which has caused pain for her for 35 years. Henry, let's show our audience how a disc injury like this causes back pain.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our animation that the disc is painful because of this process called inflammation. Without inflammation, you have no pain. So why is the disc inflamed? You saw from the video, you get a tear in the wall of the disc, then the nucleus or stuff in the middle pushes into the tear, and that actually causes inflammation to happen in the tear. Nobody knew this. We discovered that. I discovered that process here at Duke Spine. Most doctors don't know that discs are painful. They don't believe discs are painful. The insurance companies, they don't want you to know your discs can become painful, because then you've got something that can be fixed and get rid of your pain. And they just don't want to pay for surgery, because surgery is the only way to fix disc pain. There are two surgeries that work. One is the Duke laser disc repair. You're watching it now. This is the best treatment in the world for a painful disc. Another option is to fuse the disc with screws, rods, and cages. I used to do that surgery before I did the laser surgery, and if it's done properly, it will cure your pain. But you have to do all the discs. Remember, we talked about discs. 2.4 discs per patient is the average. So if the surgeon is only fixing one disc with fusion, you're still going to have pain, right? And that goes back to Jeremiah's point. He thinks that his pain could be coming from the next disc next to it, which is 6 millimeters, which is pretty collapsed and degenerated, but that doesn't mean that's the source of pain. Many people are misled to believe that that would be the source of pain. It could be, but it could be that his pain is coming from his facet joints. So let's show the audience, Henry, how the Duke laser disc repair works. And then we'll talk about facet joints, and we'll show them how facet joints can be painful.
Of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video that the way we get rid of the pain from the painful tear is the laser surgery you're watching right now. It's called the Duke laser disc repair. I'm the one who invented the surgery. I pioneered it 19 years ago. We've even published it 12 years ago. It was our first No, it was about 13 years ago was our first publication, maybe even 14 years ago. And we've been doing this surgery now for almost 19 years with tremendous success at curing pain. Curing. When I say curing pain, I mean eliminating the back pain from the disc permanently. It never comes back unless, of course, you go out and re-injure your disc, which some of my patients actually do. We have a 1% reherniation rate. That means 1 out of every 100 will go out and reherniate the disc, and they get pain from it afterwards. So it does happen. Even with my procedure, it happens. How are we doing on irrigation? Good? All right, look at that. That's the epidural space. Look how red it is, guys. See all the redness, the pinkness? The pink is red. It's red because it's inflamed. There's so much inflammation in the back of this disc, which shouldn't be there, by the way. It should be white. That's why this patient has had pain for 35 years, is this inflammation in the back of her disc right here. We are at the back of the disc. We're just going to clean up another minute, and then we're done with this disc. We're going to move on to the next one, which is the right side, L4-5, and then we're going to be done. We're going to come back and we're going to fix our SI joints. We'll take any questions you have, Henry.
Yes, sir. All these next questions are coming from Raj once more on YouTube. First question asking, Doctor, the surgeries you do look so easy and simple compared to a fusion/disc replacement and offer better outcomes without device complications. It almost defies logic, right? It's great.
Yes, Raj, you are correct. And the problem, though, Raj, is these other surgeons, the way that I get to the disc from the side is called transforaminal approach. It is not taught to spine surgeons. I did not get taught this, and I went to the best neurosurgery training program in the world at University of Florida back in the 90s. That was the number one. I turned down Harvard, Hopkins, Columbia, Yale, all the top other neurosurgery training programs. The best was the University of Florida, Seattle, and the Barrow Neurological Institute in Phoenix. Those were the top three. And they were my top three, but my number one was UF. So I went to the best training program in the world for neurosurgery, and they did not teach this approach. This approach was developed basically right before I started my residency. It was developed in Pittsburgh by a orthopedic surgeon, Dr. Parvis Camben. So it was unknown to my professors, and it remains unknown to professors in America. Now, in China and India and some other countries like Germany, they are learning this technique of the transforaminal. But there's a problem that the companies that manufacture these devices, these tubes, everything we use, this metal stuff, the companies that make these things, they actually drive the educational process now for surgeons. It's no longer surgeons driving knowledge to other surgeons based on what's good. It's now companies that are teaching the surgeons what to do and what not to do. And unfortunately, in India and China, Asia, there's a technique called UBE, and it's a unilateral biportal, but they don't do transforaminal. They don't do what we're doing. By the way, here's a few pieces of disc herniation. You guys see this?
Yes, we do.
You know, I'll put it right here. Okay? We took out many pieces. These are just a few that are laying around. The point I'm trying to make is endoscopic spine surgery is certainly growing in popularity worldwide, not in America, but in other countries. And what's growing is this UBE technique, which is not what I do. I do a far superior technique than a UBE. But the UBE is easier for surgeons to do. This is a harder technique. Yes, I make it look easy, but I think this is an easier technique than all of it. But the UBE company that makes all the metal tubes and stuff, they're promoting a translaminar approach where you go through the lamina. You have to take away part of the bone, ligaments to get to the disc. And then they're just decompressing the nerve root. They're not cleaning the tear like we do. We're the only ones that clean the tear, and of course over time that will change as other surgeons learn that cleaning the tear is the key to getting rid of back pain, because I'm teaching them that through these videos and through my publications. But right now, this is, in my opinion, the easiest surgery to do, and that comes from a surgeon who's done it all. I've done all these surgeries, incision. And I can tell you this is the easiest and safest and best results of any treatment in the world. Let me say, if there was better surgery than this, I would be doing it. Shot, that's it. But there is no better. A lot of people don't realize that I'm a top trained spine surgeon and neurosurgeon in the world, and that there's no surgery I can't do. I can do it all. We actually have all the equipment, all the resources right here at our center. We can do anything. We have microscopes, we have endoscopes, we have fluoroscopes, we have the best operating tables, the best of everything. And I have the training. There's no reason I can't do any surgery here, but we choose this surgery because it is the very best for the patient with respect to outcomes. The outcomes are the best. So yes, I agree with you. But right now, and that's part of my movie, Shot, that's it, is that's the scam, the spine scam, is that surgeons are recommending the treatments and performing the treatments on patients that are invasive. They don't work because that's what they're being taught to do, and they're being who are all being paid by the companies to use those implants, those products. And so it's a broken system that begins with bad education, bad training, with techniques that are very profitable for hospitals and surgeons and the companies selling the metal, but they're not good for the patients. That's the basis of Spine Scam, my movie. And this information is literally just starting to come out. Like, the public is just becoming aware of it now, just like they were aware of the opioid crisis problem, where doctors were prescribing opioid painkillers for many years. people were getting addicted to them. They were then becoming heroin addicts, living on the street, and just their lives destroyed by these pain pills, right? Well, now we have a cure for this back pain. Right here, you're watching it. So there's no excuse. We broadcast the surgeries. I've published the data. You know, we're trying to raise awareness, but the system is broken. The companies that sell the screws, rods, cages, the neuromodulators, all the things that go in, they're pushing their devices, telling the surgeons, put this in, we'll give you money. And the patients are the victims, and their patients don't know what's happening. That's why we're raising awareness. Yeah. It's hard, though, when you're the only one doing the right thing for people and everyone else is against you because what you're doing is going to hurt their business. Medicine has become too much of a business rather than what's right for the patients. Greed. All right, next question.
Next question coming from Raj once more on YouTube asking, you said that you can't get rid of the whole herniation of the disc.
Correct.
Is it because it's dangerous to try to get that deep in that space as you may hit the spinal cord or nerve roots?
Raj, thanks. Great question. The answer is no. We're not worried about injuring the spinal cord where we are. The spinal cord is not here. The spinal cord ends up at L1. We're down at L3, L4, L5, S1. The spinal cord ends way above where we are. So we're not worried about a spinal cord injury right here. Now, the reason we can't get the whole herniation is because of the angle of approach. There is no surgical approach that gives you the entire herniation from left to right, front to back, where you can take the whole thing out. Think about it as the enemy is in a valley and you want to spy on them. So you go to the highest mountain and you use your binoculars and you look and see where they are. But there's some small hills in the way. You can't see them all, but you can see most of the view. So it's just about being able to get to and see, and it has to do with the structures around you, like the pedicle and the fecal sac and the facet. Those are all structures that limit your access. But here's the thing. We have an old saying. I don't know where you live, but we have an old saying in America. It's, if it ain't broke, don't fix it. Have you ever heard of that? And it's a simple concept. What it really means is, if what you're doing is working, don't change what you're doing. You know? There is nothing in the world that comes close to this surgery in terms of the effect. It is the very best. There is no reason to change what we're doing. We've had 0 complications, 0. We have no, every patient has 99.6% pain relief on average. That's perfect. I mean, you can't do better than that. So why change our technique to get more herniation out when we're getting 60% on average, and the patient's symptoms are gone, right? The goal is to get rid of the symptoms and keep them gone for the rest of their life and let them have a normal activity, normal living. And that's what we're able to do with this treatment, but only removing 60% of the herniation on average. So why change it? There's an old saying, don't gild the lily, but what is it? Better is the enemy of good. All right, this is phenomenal right here, folks. Look at this. This is incredible. You guys see it? The red. That's the inflammation we're talking about. That should not be there. That is where the pain is coming from. And that is not visible to any other surgeon in the world but an endoscopic transforaminal surgeon. There it is. You guys see it? Incredible. Right there.
Yes, we do.
That's what we have to get rid of. That's where the pain comes from.
We have a couple more questions.
Sure, I'll take them.
This next one coming from Raj once more on YouTube asking, Doctor, is your surgeries safe for all ages and medical conditions?
Yes, this surgery is the safest surgery in the world. There is no spine surgery safer. It is literally the safest. And it's safe for all ages and all medical conditions.
Next question from Raj once more on YouTube asking, is that red inflammation irritating the nerves causing the pain signals?
Yes, that's exactly right. Henry, let's show the audience how this annular tear causes inflammation, which then sends pain signals up to the brain.
Of course.
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, welcome back. You can see from the video that to answer your question about the inflammation, the red stuff, the pink stuff is the inflammation in the tear that you see on our video. There's still herniation there. That is what has to be debrided, removed, cleaned up, and that's what we do with the laser. This is a piece of herniation right here. A good sized chunk. Yep. All right, we're almost done with this disc. And I think she's going to do really well. Any more questions?
Yes, we have.
There's some more right there. You guys see there's more inflammation right there.
Yes, we do.
So remember, the inflammation is not one spot. It can involve the entire tear. And you're seeing it in different places in the tear. This is the Duke laser disc repair. It's the only surgery in the world that finds the source of back pain in the disc, the inflammation, and cleans it out with the laser. There is no other way to get rid of it. You can take the whole disc out and fuse if you want, but why do that to somebody when it's not necessary? It's overkill. It's dangerous to do fusions. You only want to do fusion when there's no other choice. So we don't do fusion anymore unless there is no other choice. All right, you have a question?
Yes, we have two more questions. This next one coming from G.M. Carrington on YouTube, asking, I assume this is a lot less expensive to do than disc replacement. How can I get an idea of cost and payment method?
The way you find out about cost is you do what's called the free MRI review, and you let us diagnose where your pain is coming from. That's the first most important step. It's done quickly. If you upload your MRI today, the images, they're called DICOM images. If you fill out the form, it takes 5 minutes to fill out the form, and it takes 5 minutes to upload the images. If you do that, we can do your MRI review this week. Sam is the one who is in charge of the MRI reviews, and she's working on MRI reviews right now. But you will meet me by Zoom. I will make the diagnosis based on your physical exam and your MRI findings, both. And then I will tell you what's wrong. And then we can give you the exact cost of what it costs. Now, if you're in the United States, we can bill most insurances. Doesn't mean they're going to pay, but we can at least bill them. We do know that Medicare will not pay. Medicare will not pay, but we've had Medicare pay. But I don't like to tell people it'll pay because 99% of the time it will not pay. But we've had some patients bill their Medicare and they paid the patient. So it does happen, but it's just very rare. Is there another question?
Yes, we have a question coming from Lanu on YouTube.
Hi, Lonu, welcome.
Asking, do you wear a microphone? You sound very clear.
Yes, I wear a microphone. Henry is in charge of the sound.
I am, and that is a great compliment that to hear. So thank you so much, Lon.
Henry does a great job. So, Henry, why don't we show the audience that what facet joint pain, how that happens? Because the disc is the cause of pain, primary cause of pain 85% of the time, but the facet joint is around 10% of the time the main cause of pain in the back.
Of course.
All right, welcome back. You can see how the facet joint is also a major cause of back pain through inflammation, just like the disc, but a little bit different location. And it's off to the side of the spine. There are 5 discs in the lower back. There are 10 facet joints, 5 on the right side, 5 on the left side. And this patient does not have facet pain at this time. She could develop it in the future, but she doesn't have it now. We are pretty much done with this disc. So we fixed 3 disc areas, 2 discs, but one of them was on both sides bilateral. That was the L4-5. And now we're going to end the stream. We're going to come back, and on the same patient, we're going to do a sacroiliac joint Duke plasma rhizotomy, SI joint DPR, because she has horrible pain in her SI joint as well. And we don't want to leave that pain there. We're going to be fixing that next. And we got a nice brand new first time ever featured in the world. You guys are going to see a very first. This is a new animation that we've been working on, Henry and I and Sanjay and our animator. And this is going to be the first time in history it's going to be aired. It's hot off the press. And it's going to be incredible. It'll show you guys how it works. We're done here, and I'll take any other questions. Otherwise, we're going to end the stream, and we'll be back in 10 minutes, or 5 minutes, I should say, 5 minutes for the SI joint.
Last question coming from Raj once more on YouTube, asking, would Blue Cross Blue Shield pay Bupa Global?
Great question. Blue Cross Blue Shield is one of our best payers. But that said, they only pay about 5% of the time. Now, we are getting ready to go to Blue Cross and kind of take them to court to see if the judge or jury makes them pay, and I think they will. Once that's done, then we should have all Blue Cross Blue Shield patients covered. But unfortunately, it's going to require us to have a jury decide, and I think we'll prevail. If you have Blue Cross Blue Shield of Florida or Anthem Blue Cross, or Blue Cross Blue Shield of Florida, let us know, because that's a special case and we may be able to get it done sooner. Here you go. So do the MRI review. Let's find out what you need done and let us know if you have Blue Cross Blue Shield of Florida or Anthem. Well, here's the incision, folks, right here. It is 7 millimeters. It's tiny. You can see it. Band-Aid. We're going to be putting a Band-Aid on in just a minute, and we're going to move on to her SI joint.